Hi, it's Chris Hitchko with Show Up Academy. Today we're going to go over what the assessment looks like. The assessment is probably one of the most overlooked aspects of personal training. Today people play the game, as I call it, where they just bring someone in, they kick their ass, take them through a really high intense workout that's going to make them sweat, get the client sore, and they feel like that's what you need to do to be successful. That's just not the case. It lies in the assessment. Hands down, the most important thing that you can be doing is sitting down with your client, going over a medical history and a PARQ, physical activity readiness questionnaire, where you learn about the client. You're going to learn about if they have coronary artery disease, if it runs in the family, what type of job they have. That's the objective and subjective information that you will obtain. You're going to get resting measurements, circumference, blood pressure. And you will use this data as you progress training with you to show success long term. If you just go off of the scale, you're essentially flipping a coin. So why not have a lot of markers such as push-ups and body fat and measurements and your waist or hip circumference, so then you can help show your client success long term. Then you're going to do some type of cardio test. I would suggest maybe just a simple step up, maybe a YMCA, 90 second on left leg, 90 second on right leg, and then check their pulse to see how their heart rate responds, referred to as heart rate recoverability. After a couple minutes, if the heart rate is still really high, maybe you shouldn't do some type of circuit in the beginning. A movement screen, maybe you want to do a shoulder flexion, overhead squat, single leg lunge. Maybe you do a push-up or a pull. You need to screen your clients before you start taking them through workouts. Everyone today wants to bench, deadlift, and squat, but if you can't move properly, you haven't earned the right to move. So do a screen to see how your client moves. If they have shoulder pain, a simple question: how does this feel? If your client goes, okay, well, you should probably limit the movements to below the neck. What about a push-up? If they're shrugging for a squat, if they're valgus, you can learn so much through the movement screen. It's imperative to see how your client moves. Performance. That's where you can take them into the gym, take them through a few exercises just to kind of, again, it's kind of like the screen, but you're going to then do some exercises to get a baseline. So maybe a 10 rep max, maybe on a bench press, maybe you do some Aussies or a pull-up. You're gathering data so you can progress and show them success long term. And then last, what you're going to do in the assessment is a PT demo. So after I've done the PARQ, they're okay to exercise, I get some cardio data, I'm going to get making sure their heart's healthy, a screen for movement, and then performance. Then I'm going to take them through a little demo of what training looks like. So maybe I do an Aussie, maybe I do a step up curl press, and then also some push-ups. I take them through that, maybe a plank, and I up the intensity a little bit so they can get a really good feeling of what it's going to be like when you train with me. And then you're going to take them through sales. You're going to sit them down, show the value, repeat their goals, and then help add that value long term, and then swipe the credit card.